Good morning, Mr. Johnson. I have your recent blood work results here. Let's go through them together.
早上好，医生，是不是一切都正常啊？
Overall, there are a few things I'd like to discuss with you. Let's start with your complete blood count. Your hemoglobin level is slightly low at 12.3, which could indicate mild anemia. Have you been feeling more fatigued lately?
是有点累，不过我以为是工作压力。
That's possible, but we'll keep an eye on that. Your white blood cell count is normal, at 6.5, so no signs of infection or immune issues at the moment.
好，那胆固醇呢？
Your lipid panel shows your total cholesterol is 215, which is a bit elevated. Your LDL cholesterol is 140, which is above the recommended range. Ideally, we want it below 100. Your HDL is 48, which is acceptable, but could be higher.
那我是不是要吃药？
Not necessarily. We can try lifestyle modifications first: dietary changes, regular exercise, and weight management.
好，我可以做到。
Now, let's review your blood glucose levels and A1C. Your fasting glucose was 115, which is in the prediabetes range. Your hemoglobin A1C, which measures average blood sugar over the past 3 months, is 6.1%, also indicating prediabetes.
那就是说我有糖尿病了。
You do not have diabetes yet, but you're at high risk. It's very important to monitor your diet and physical activity closely.
明白。
Let's look at your liver enzymes. Both ALT and AST are slightly elevated. ALT is 48, and your AST is 42. It could indicate mild liver inflammation, possibly related to fatty liver, alcohol use, or certain medications.
我需要担心吗？
Not necessarily, but we may want to repeat the test in a few months and consider an ultrasound if the levels remain elevated.
明白。
Your kidney function tests look good.
明白。
Now, your thyroid panel showed that it is slightly higher than normal range. Currently, it is at 5.8. It suggests possible subclinical hypothyroidism. We'll monitor it, and if you develop symptoms like fatigue, weight gain, or cold intolerance, we may need to start thyroid hormone replacement.
明白。
Your prostate-specific antigen is 3.9, which is on the higher side for your age. It does not mean that you have cancer. PSA can be elevated due to benign prostatic hyperplasia, prostatitis, or even recent sexual activity.
我可以怎么样降低我的指数？有什么需要我做出改变？
While there's no guaranteed way to lower PSA levels, there are several lifestyle changes that may help. Maintaining a healthy weight, eating a balanced diet rich in fruits, vegetables, and healthy fats, and reducing red meat and processed foods may support prostate health. Regular exercise can also help improve your overall health. Some studies suggest that reducing alcohol intake, quitting smoking, and even managing stress levels could have a positive effect. We'll monitor your PSA over time. If it continues to rise or you develop symptoms like urinary hesitancy or frequent urination, we might refer you to a urologist for further evaluation.
明白。
Your vitamin D level was 22, which is low.
是不是这个原因，我的关节有时候会痛？
It could be contributing. Low vitamin D can affect bone health and may cause muscle weakness or fatigue.
那我要吃保健品吗？
Yes, I recommend starting vitamin D3 1000 to 2000 IU daily, and we'll recheck your level in a few months.
明白。
Your iron level is 28, which is on the low side. It could be related to the mild anemia we saw in your complete blood count.
那我要吃保健品吗？
Possibly, but first, we'll investigate whether you might have dietary deficiency or another cause, like chronic blood loss from gastrointestinal issues.
那我要做其他检查吗？
I'd like to order a fecal occult blood test to rule out GI bleeding and perhaps a colonoscopy, if you haven't had one recently.
我从来没做过结肠镜。
Since you're over 50, it's recommended as a screening test for colorectal cancer anyway.
明白。
When we are done, my scheduler will come in to help you schedule a colonoscopy. We also checked your electrolyte panel, which means sodium, potassium, and calcium levels are all within normal range.
明白。
We also screened you for hepatitis A and B, since elevated liver enzymes can sometimes be linked to viral hepatitis. You tested negative for both hepatitis A and B, so there's no current infection. However, you don't have antibodies against hepatitis A or B, which means you've never been exposed to either virus, and you don't have any immunity. It means you're susceptible to both infections if you ever come into contact with the virus. Would you like to get the vaccine today?
是不是很容易感染肝炎？是不是一定要打疫苗？
For hepatitis A, the virus is often transmitted through contaminated food or water, especially if you travel to certain regions. For hepatitis B, it's primarily spread through blood, sexual contact, or from mother to child at birth. I strongly recommend you get vaccinated for both hepatitis A and hepatitis B. Both vaccines are safe and effective, and they provide long-term protection. There's even a combined vaccine that covers both, so you wouldn't need separate shots.
好，打吧。
When we are done here, my nurse will come in to give you the shot. Lastly, your C-reactive protein is slightly elevated at 3.2, which could indicate some low-grade inflammation. It could be related to obesity, metabolic syndrome, or even chronic low-level infections. You do not need to worry at this level, but it's another reason to focus on diet, exercise, and maintaining a healthy weight.
明白。
Let's schedule a follow-up in 3 months to reassess these labs and see how you're doing with the lifestyle changes. So, wait here, my scheduler will come in to schedule a colonoscopy, and my nurse will come in to give you a hepatitis shot.
谢谢你解释的这么详细。